For the TIF procedure, prior to undergoing therapy, the workup and evaluation would include a few things. We would like to do a pH study to look at acid reflux. And that pH study is done with a Bravo system where we place a little capsule inside the esophagus. We have the patient wear a monitor for 4 days and we look at acid reflux to document that it is GERD that we're dealing with. At the same time, we can also do a motility or a functional study looking at the esophageal function. We want the esophagus to function so that if we create that valve at the bottom of the esophagus, that patients will not have issues swallowing. After the diagnostic evaluation, the treatment is approximately an hour procedure. The patient is sedated, the patient stays overnight, they go home the next day. The diet will be about 6 weeks of clear liquids, advanced to thicker liquids, soft and pureed, back to normal diet at 6 weeks. We ask that the patient stays with the diet so that there's no problem with food getting stuck, and the activity restriction is also for about 6 weeks. We ask the patient not to lift anything heavy. We encourage ambulation. We encourage walks and more normal activity. We limit the weight to 5 pounds in terms of heavy lifting. Patient typically goes back to work in a few days, depending on what type of work they do. After the procedure, they will have a sore throat. They may have a little left shoulder discomfort. We send the patients home on a tiny little bit of pain medication as needed. Usually patients don't need it. We keep patients on anti-acid medications for short term, just for healing. Eventually, over the recovery period, we will taper the patient off their anti-acid medication if possible.